Hello, thank you for taking the time to sit with me today. My name is Jackie Walter, and I am a licensed health and Medicare insurance broker. I'm really passionate about educating seniors on how Medicare works so they can make informed decisions about their health insurance, have access to providers that are important to them, and get the lowest costs on their prescription drug copays. Today we're going to be diving into the 2021 Medicare Advantage Clarity presentation. Although this presentation is branded from United Healthcare, I do have all the contracts with all the major carriers in this market. So if there's another plan that you're interested in, there's a very good chance that I can get that for you. We're really just going to be answering the main questions that a lot of clients have that instead of, trying to answer on a one-off basis, I just want to give you a good foundation for Medicare. And then when we do our phone call or our Zoom, appointment, you will be able to ask me some follow-up questions. But this will give you a foundation. You can listen to this as many times as you want until you really understand the topic of Medicare. So step 1, enrolling in Original Medicare. Original Medicare has two parts. Part A is your hospital coverage. That helps pay for hospital stays and inpatient hospital care. This part is generally zero premium as long as you or your spouse has paid their Medicare payroll taxes for at least 10 years. Part A does have a deductible. In 2021, the deductible is $1,484 for Medicare Part A. What that means is upon admittance to the hospital, if they deem you as an inpatient and keep you there, you will owe $1,484 for that hospital visit. Part B is all your outpatient coverage, like doctor's visits, labs, x-rays, emergency room, chemo, radiation, and dialysis. Part B has a current standard monthly premium of $148.50, and Part B also has a deductible of $203 per calendar year. And then you are responsible for 20% of all your outpatient costs, and there's no max out of pocket on Part B. So that means if you have a $100,000 chemo treatment, you are liable for 20% of that. If you don't want to be responsible for those large deductibles and that 20% ongoing expense with no max out of pocket, there are options to supplement your Medicare. Option 1 is you keep Part A and B, which is known as Original Medicare, and then you put behind it in a secondary position something called a Medicare supplement, otherwise known as Medigap. This coverage goes behind Original Medicare and helps pay most of the out-of-pocket costs that come with having Original Medicare, like that Part A deductible that we talked about of $1,484 and that 20% Part B liability. We would pair this Medicare supplement with a Medicare Part D prescription drug plan to give you access to your preferred pharmacies and prescriptions. Medicare Part D enrollment does have a late enrollment penalty if you don't enroll when you're eligible, so it's important to add that Part D plan even if you're not taking prescription drugs currently. Option 2 is to go with a Medicare Advantage plan. This replaces Part A and B through Medicare, and it becomes your primary insurance. Medicare Advantage plans provide you all of your outpatient hospital drug coverage under the private insurance company like Providence, United Healthcare, Aetna, Humana, to name a few. All the billing and all the claims go through this private insurance company, and they often throw in extra benefits that Original Medicare doesn't cover, like dental, vision, hearing, a gym membership, and much more. All the Advantage plans have their own unique features, so it's important to talk with a broker who works with all of the options to see which one is the right fit for you. Trying to review 40+ plans on your own can be overwhelming. Step 2, we're going to cover eligibility and enrollment details. You're eligible to enroll in Original Medicare when you are a U.S. citizen or a legal resident who has lived in the U.S. for at least 5 consecutive years. You also need to be 65 years of age or older, or you can be under 65 and qualify on the basis of a disability or special situation. I provide my clients with step-by-step instructions on how to enroll in Medicare when they are eligible. The first time you're eligible for Medicare, you get a 7-month initial enrollment period. It starts 3 months before the month of your 65th birthday, then includes the month of your birthday, and then the 3 months following your birthday month. If you enroll in Medicare before your birthday month, your coverage will start on the first day of the month that you turn 65. So even if your birthday is later in the month, your coverage for Medicare will start the first day of the month. However, if you delay enrollment until after your birthday month, you could have a gap in coverage of up to 3 months. So it's best not to delay enrollment unless you qualify for other coverage through an employer-sponsored group plan. If you delay enrollment when you are eligible and you don't have another medical plan or prescription drug coverage, you could incur a late enrollment penalty, and that penalty follows you for the rest of your life. If you are enrolled in Original Medicare when you first eligible, you would then be eligible to start a Medicare Advantage plan or a prescription drug plan to also start the first of the month that you are eligible. For example, if you are covered by Medicare starting May 1st of 2021, you could enroll in a Medicare Advantage plan before May 1st to also have that become effective on May 1st and become your primary medical and drug coverage. If you want to change Medicare Advantage plans or prescription drug plans, you have an opportunity every year to change plans during the annual election period that runs October 15th through December 7th. This is where anyone on Medicare can enroll, disenroll, or change their plan with no questions asked. The new plan you pick will start on January 1st of the following calendar year. Medicare Advantage plans can change their provider networks every so often, so it's important to work with your broker to make sure that your doctors are still covered next year on your current plan, or have the broker help you switch to a plan that covers your preferred providers. Additionally, if you pick a new Medicare Advantage plan during the annual election period and you want to change plans again or go back to Original Medicare plus a prescription drug plan, you have another opportunity to make a one-time change from January 1st to March 31st of the following calendar year. This is known as the Medicare Advantage Open Enrollment Period, and it's specifically for Medicare Advantage members to switch plans one time or go back to Original Medicare. Depending on your circumstances, if you retire, lose employer coverage, move out of your plan's service area, or qualify for extra help, or if you have been diagnosed with a chronic health condition, you may also qualify to change plans at other times during the year using what's called a special enrollment period. At this time, we're going to cover the advantages of Medicare Advantage plans. Medicare Advantage plans have high member satisfaction. Did you know that 24 million people enrolled in Medicare Advantage plans as of February of 2020? And 93% of the seniors with a Medicare Advantage plan are satisfied with their benefits. The reason is because they have a significant decrease in their health expenses on the Advantage plans. Medicare Advantage plans also cover things that Original Medicare does not cover, like prescription drugs, routine vision and hearing aid coverage. Additionally, Medicare Advantage plans all have a max out-of-pocket, whereas Original Medicare has unlimited financial exposure. Some things to remember about Medicare Advantage plans are: you still need to pay your Medicare Part B premium. That doesn't go away no matter how you supplement Medicare. Some Medicare Advantage plans do have a network of providers that you must use, and some give you out-of-network coverage. It's best to talk to a broker to determine which option is the best fit for you. You may qualify for financial assistance with your premiums, deductibles, and prescription copays if you are low income. Medicare Advantage plans have one card for everything, so you don't need to show your red, white, and blue Medicare card at your appointments. You do need to keep your member ID card handy. All Medicare Advantage plans have to offer at least the same as what Original Medicare covers, plus they give you that max out-of-pocket as a financial safety net. It's very important to understand that many Medicare Advantage plans offer prescription drug coverage so that you can have access to the prescriptions that improve your quality of life. However, each plan has its own drug formulary, meaning what specific drugs it will cover. So it's critical to do a plan review each year with your broker to make sure that your drugs will be covered the next calendar year. October 1st of every year, the new plan formularies and cost sharing are released to brokers so we can help you plan for the next year. While prescription drug coverage is embedded in the plan, each plan still has deductibles, copays, and coinsurance that you are responsible for. If you take generic drugs, your costs will likely be much lower than if you take brand name drugs, so always ask your doctor if a generic drug will work for you. A broker can help you find a plan that has low $35 copays for insulin, 0 copays for generic drugs, and lower deductible plans. Prescription drug coverage also has phases. The first phase is the deductible phase. If applicable, you would be responsible for 100% of the cost of your drugs until you hit the deductible. These typically only apply to Tier 3 through 5 drugs like brand name and specialty drugs, and the deductibles can range from $0 to $445 per year. That's a huge range, so ask a broker for the right fit for you. The second phase is the initial coverage phase, where you would pay the copay or coinsurance for your prescription, and then the plan covers the rest of the drug costs. You stay in this phase until the total cost of your drugs reaches $4,130, and then you enter the next phase. Phase 3 is called the coverage gap, or donut hole. In this phase, you switch to paying 25% of the cost of all of your drugs, and then the plan pays the remainder. Not very many people enter this phase, as you do have to have some pretty high-cost drugs like inhalers, blood thinners, cancer drugs, arthritis drugs to get into this phase. Once your total out-of-pocket costs reach $6,550, then you enter what's called the catastrophic coverage phase, where you just pay a low copay of $3.70 for generic drugs and $9.20 for brand name drugs, or 5% coinsurance for all drugs, whichever is greater. If you qualify for extra help from the federal government, that is a low-income subsidy program that you could qualify for, which may help lower the copays, deductibles, and thresholds for you. As a broker, my services are free to my clients. I work with all the major Medicare Advantage plans in Oregon and can help look up your doctors, hospitals, specialists, and clinics to make sure they're part of the plan network. I can also assist in checking your prescription drugs to ensure they're covered by the plan, or see if we can find you lower cost coverage. I can help find out if you're qualified for other benefits. For example, if you are on Medicare and Medicaid, there may be special benefits for you like transportation and over-the-counter funds. I can also advise how to utilize a Medicare Advantage plan, even if you get other health coverage from TRICARE or the VA. Again, my name is Jackie Welter with Translating Insurance, and I appreciate your time today.